Complex on the screen, healthcare in between. Physics, art, and math guide us down this path. Historical tales come alive, where science and stories dive. Blended facts with heart, knowledge from the start. Meet rich blues we sing, to the future memory. Health and science in the mix, Midridge got the fix. Complex subjects made
right
clear,
now
every episode
in ways that we actually acquire knowledge
leads the way,
and ways that make me more efficient.
in the world of digital streams, turning knowledge into dreams. Through the tales of old, new stories unfold.
Thank you so much for joining with me. It is truly an honor and a privilege.
MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming.
Hey, welcome to the MedBix Webcast. This is Ramana Annamaraju. I'm the host. In the forefront of all the innovations, we don't hear about nurses that much in the innovation, technology guys and the doctors, and this is a time we need to bring the nurses to the forefront of for the healthcare innovations. That's one of the things that I love to do, and I bring a lot of nurses to the things. But not only nurse leaders, these are all, forefront of a patient care. If you go to the ER room or you go to the doctor's office, the first person you see is a nurse. She's the one taking a triage or taking vitals, or you do. She's the first one to experience your pains, your understanding your treatment is working or not. She is the first witness. And then we need to really understand, we need to give her a true role in the healthcare innovation. It's not a role of, you don't start with the technology. The Plato said that you start with the philosophy of care first, then methodology, then technology. Not you don't start with the technology first. That's a reverse, that's a process you don't do. You start with the first that for example, philosophy of care. Philosophy of care is taking care of the people, taking care of reducing the pain. These are the philosophy that is you need to start with. Then you create a methodologies, algorithms, whatever it is. Then we all in Silicon Valley comes in the last, not the first one. So that is, I always say, with healthcare without nurses is like a emperor without clothes. Rather, I put it better way. Is a emperor without the healthcare without nurses is a healthcare without a philosophy, without a purpose, without a compassion. So we need the nurses in the part of the equation. Talking about and also the great thing about nurses are they are great storytellers. I hear a lot of these things. They are the true storytellers of the day. I used to go to the doctor's offices all the times. I used to hear a lot of stories. That's very important. We are humans. We only remember stories. We don't remember all the equations. Even a physicist like me, we don't remember the equations. We remember the stories. The story is a powerful, philosophy behind it. So that's one of the storytellers I'm going to bring. She is a very powerful woman. She is the head of she's the healthcare strategy for Oracle. And then she was registered nurse. Did MBA. She is from Norfolk, Virginia. That's where all the military bases and everything is there. UFOs, unidentified flying objects around there. But she doesn't belong there. But she is really a true human. So let me bring CJ Robison. Let me ask you a little bit of a welcome to the MedBix Webcast, CJ. I'm honored to have you.
Oh, Ramon, I'm so delighted to be here today. Thank you so much for the invite. I've been looking forward to this conversation.
So, CJ, tell us a little bit about your background. I gave a little bit about, just tell us your journey up to this point, how did you end up with being a nurse too, all the way in technology side a little bit?
Oh yeah, absolutely. I'm always happy to tell this story. So, I spent the first about roughly like 10 years of my career as a nurse leader out at a hospital system in southeastern Virginia. Um, and I could be a little long-winded, Romano, so you'll have to cut me off at some point. But I remember even from my first day as a nurse, which I remember that whole day so vividly. But I remember even interacting with the technology back then, the EMR I was using on that first day. Like I was just overwhelmed and astounded by how challenging it was to use, and just like that onboarding process, and like the continued challenges of the documentation burden, right? I think that's something that a lot of new nurses would probably continue to say. It's just the documentation burden and the technology burden was pretty steep. And that was a long time ago for me.
Yeah, I need to interrupt. Very,
Oh yeah.
I got a small technical problem. I forgot my power plug, and I'm going to bring it. So let Rajita come on and listen to you.
Oh, very good. Yes.
Go ahead. Go ahead, please. Yeah, just keep telling your story. That's it.
Okay, great. So really early on, I realized, just the power of, you mentioned ensuring that the voice of the nurses at the forefront of the decisions being made around the technology that is being deployed to support nursing work. So I got involved in all things like what we call nursing shared decision making. So these are organizations that like really empower the voice of the nurse to influence decisions that impact their work. And that led me to being the Magnet program director for that healthcare system or for that hospital. And I learned a lot in that role. For those of you that don't know what Magnet is, it's the highest designation a healthcare organization can receive for nursing excellence. And in order to be a Magnet organization, you have to have top quartile performance for, a variety of indicators, whether it's, hospital-acquired conditions like falls or hospital-acquired infections. You have to be in the top quartile performance. You have to be in the top quartile performance for patient satisfaction and nurse satisfaction. But the true power of Magnet, and something that I've brought over with me to my current role as Director of Healthcare Strategy for the Oracle Communications team, is the philosophy of Magnet, which is really you have to create a structure and process to drive the outcomes that you're going for. And that is something, Romana, that you mentioned in your intro. You need the philosophy before you can get to the technology. I know I'm being long-winded here, but you asked about how I'd made the jump from, being a clinician at the bedside to technology. So I remember the night I decided to leave healthcare and pursue something different. It was 1:00 in the morning. I was a manager, and so we had yet another capacity management crisis. It wasn't really a crisis, but it felt like it to me at the time, where we had more patients than we had beds for, and we certainly were trying to figure out how to staff what was functionally 2 extra units worth of patients for the hospital. And it was the same cycle that happened every year during flu season. And my husband is a software engineer, so I knew that technology could, we could leverage technology to prevent this from happening. And I was so tired of just like the constant cycle. And I had 3 little kids at the time, and my baby woke up, I think it was like around 1:30, and I was going to have to go and staff my unit at 6 a.m. And that's when I was like, I know that there is something we can do something better. We can do something better. And so that's really what motivated me to move over to Oracle. And, it has been a pleasure, an honor, a delight. It's been really challenging now to sit at the forefront of where we can leverage this, swiftly evolving technology to really change not just the lives of our patients, but to really improve the well-being for our clinicians, and to honestly prevent a lot of the experiences that I had as a nurse from happening for my daughter, who wants to be a nurse when she grows up. So, that's definitely one of my things that it's kind of like my guidepost, if you will, that my daughter will have a different experience in her career than I had. And we can definitely leverage technology to accomplish that. That was long-winded, but I hope that's what you wanted me to say.
I'm back, but just I'm working on it. Thank you. Yeah, just let me bring actually the here on the screen that she can be probably is useful to talk with her together. Yeah,
Yeah, thank you.
yeah. Sorry about that. This never happened. This is one of the some
It's always the first time. I'm sorry. I'm bringing
yeah,
Juju to your podcast here.
yeah. That's
There she is. Yay. So glad you're here.
so
Thank
while I'm
you
working
so
on.
much for that wonderful transition. It's very impressive how you transition from being in the hospital in the management section to the technology. I'm sure that was a huge, huge shift in the beginning for you when you got into it. So how are you fitting like at Oracle with your role as a healthcare strategist?
Yeah.
So, what is that you do in terms of fulfilling this? How are you making things much technologically better for those nurses? The struggles that you have gone through to now.
Yeah. So I'm gonna one of the things I love about this role is basically my ability to connect the voice of the folks doing the work with the folks who build the solution. And so, that going back to like the whole magnet thing, infusing the voice of the clinical staff in the design and the implementation of the tools that they use. So I like even right now, I'm on the road talking to customers and like able to bring that directly and facilitate some of those conversations with our internal teams that we're building tools that people love to use. But I think one of the things that is really important but easily overlooked is, there's a lot of like cool, really amazing solutions that we can bring to bear when it comes to improving the lives of our clinicians and like really supporting that healthy work environment that we really need to ensure that we are preserving the well-being of our workforce. But it's so important, like when you're thinking about all the different ways that we can leverage technology to improve the way that somebody's working, is to ensure that we're deploying it in a way that's really fit for purpose. And that involves deeply understanding not just how people work today, but having a really strong vision of how they can work tomorrow. And so it's this delicate balance of, we don't just want to replicate what we've always been doing and like support what we've always been doing. We do want to be able to reimagine how we work, but that requires first like some of that fundamental understanding of like what's out there and how can we like how do you really meaningfully leverage it in your day-to-day work. And so that's been an interesting component in this current role is, I get to talk with not just nurses, but leaders from all over the country. And, part of being able to carve out a seat for yourself at the table, I think is first being having a pretty deep understanding of how, like what that vision can be and what exists. Cause like we tend to paint with a pretty broad, like AI brush, like AI, like voice to text, great. Like those are like, there are really cool, like we are doing some really cool stuff with that. But like when you think about just the granularity of some of the technology available, whether it doesn't have to be AI, it can be as simple as automation. It can be AI, it can be Gen AI, it can be agentic AI. And where do you start to interweave that into the workflow? But then also I think a component that is often overlooked is how are we leveraging a lot of that data to drive the decision making and to tell the story of the clinician so that folks who have never touched a patient, but who are responsible for hospital operations can understand in an instant with a glance the power and the impact that the nursing workforce is having, not just on their patients, but on their operations as a whole.
Yeah, let me ask you, if you don't mind, Rajita, 1 second. Let me, healthy work environment. That's what I saw your video, and you were telling all of the American College of Nursing, I think, their members there, and talking about how much, what are the, I was listening to the Dr. Bill Fish, Senator Bill Fish. He's talking about green spaces in the hospitals is the biggest addition. You should do that because it's a one way to relax. There is a definite connection between the neural networks and then the brain and the green spaces. So tell us a little bit about the health work environment, besides other things that the operational things, just give us a little bit background of
Yeah.
that.
Yeah. So, again, like I love that I get to work with all these amazing thought leaders and like bring in all of their great work into this space. So, the healthy work environment is a framework that let me make sure I get this right. The American Association of Critical Care Nurses has created and measured for over a decade. Just for background, the AACN also is the organization that publishes a lot of our industry staffing standards of practice, and so and it's really important to understand like the link between the two, between staffing and the ability to build this healthy work environment. But basically, the healthy work environment measures these 6 different things within the culture of an organization, and they have a ton of amazing data that backs up, like if you are outperforming, if you're in the upper quartile of performance for these 6 indicators, you will have higher retention, your turnover will be lower, your patient outcomes will be better, all of those things that we work for. But what I love about this is like when you think back to like structure, process, outcomes, first you need to really deeply understand how your staff is feeling. And so the 6 standards, there's a variety of pieces to it, but one is like meaningful recognition, authentic leadership, and it really doubles down on some of those magnet principles too, on ensuring that the voice of the staff is involved in decision making. And so
one of the top ones, or just what you're doing, is communication skills. That's what they said. That tell us a little bit. You're doing that job great, but tell us how that communication skills are so important for the. That's the number one. That's what they said.
Meaningful communication. Effective communication. So there's a lot of different places, obviously, in which that communication is happening. And I remember even as a clinician, like being able to tell the patient's story from caregiver to caregiver, and even being able to communicate it, like not just to other nurses during handoff, but also documenting it is so important. But also being able to communicate about, hey, this is what I need to do my job well. And this is an area where it really is interesting to think about how AI can intersect here, where we've had conversations around like, can we look at how Gen AI can help transform like a note around like, hey, my shift was terrible, I'm angry about this, blah, 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 but like transform it into something that, is professional, that then you can send to management and like inspire some changes. And it's, there are some really interesting kind of niche use cases there. And then of course, there's a lot of really neat development going on around, some of those digital assistants that really support, the ability to use that voice to chart, like use that, not just transcribe a conversation, but to be able to distill it into its component parts so that you are then able to really just focus on the moment that you're having with the patient, instead of always being like distracted by the computer screen over on the side and like having to like capture, I don't know I forget what the data is, but like just a tiny proportion of what the actual conversation was. So those are some of the things that we're thinking around when it comes to.
One of the things I saw that is that one of the nurses, they use a chat GPT to create how to talk with a 5-year-old, create that, old pictures and comic book pictures, that's a very effective, sometimes that's the best way to, if we want to go back, let me go back to, you're talking about a lot about AI. Let me talk about our shock to the technology industry when Oracle bought Cerner. There's send the shockwaves to all of us, $29 billion acquisition. I don't know what Oracle is going to do, what their plans are, and everybody is very nervous about it. But Oracle has a very long-standing, one of the things they want to solve this problem is, which I loved it, is the interoperability. They wanted to get the data unification and the interoperability. That is a fragmented data we have. That's one of the top priorities, at least. That was a very striking the path that you took. So tell us a little bit about why we need this, where this fragmented data in the healthcare system, and tell me your experience of fragmented data, and then say how the unification is what at least at in the future is going to be.
Yeah. So, and I think you've heard, I mean, I don't know if you've heard, but like our founder, Larry Ellison, has talked publicly about, he feels like he has a moral obligation um, to fit, like basically bring the right technology to bear to transform the healthcare ecosystem. And I think we have all experienced the impact that the fragmented ecosystem has on our day-to-day lives. Like, whether it's, and Rajita, I know that you work, with patients on their health journeys, but whether it's just even like your own you're having visibility into your own data to know like what has been my blood pressure trend over time and how has my medication impacted that trend, and even basic things like that to, some of the bigger opportunities, which is like starting to incorporate, like wearable device data into that ecosystem. But then, you kind of back up from just the individual patient journey and start looking at like, optimizing, creating programs for your patient population that requires a very holistic understanding, and an aggregate understanding of the factors and influences at play that are preventing your patients from being healthy and staying healthy, and not just your patients, of course, but your workforce as well. And then as you like kind of zoom out and then also think about, a health system's operations, being able to link what are the things that my patient populations need with what can I do to support my patient population from a programmatic way, but also understand what are the resources I need to bear and how do I need to align and structure myself to support that. And that's where you start to get into that really amazing, the power of having like that unified platform in a healthcare ecosystem where you can have visibility into what's going on in the OR and how's that impacting the supply chain, and how do I need to start staffing and scheduling my nurses to prepare for a flex in OR patients or a flex in ED patients, and bringing in some of that other like environmental data. But then like you then go the next level up and you start thinking about how states and how you think about leveraging that data and those insights to then start to optimize for and plan for entire like state populations or federal populations. How are we prepared for the next pandemic? How is our national workforce readiness for the next big crisis? There's just endless possibilities. And then of course, the big thing is like AI. If we want to build AI models that are really going to make our clinicians and patients' lives better, you need that data to drive those models, and the creation of those, and that the data driving those models has to have it is so much more powerful when you have that kind of holistic view of the data.
One of the areas that during the pandemic we saw that the remote patient monitoring, they're giving a number of variables. I used to do a lot of it. One of the things the doctors didn't like it, because the reason is physicians and nurses did not like it, because it's too much data, and the bathroom data, some of them are real, some of them are fraudulent, some of them are nonsense. So they're all data is coming in. Who is going to watch this 24 hours a day? We need the technology to filter that out. AI need that. Now it makes a lot more sense now that AI can filter all these good things and bad things, and it gives the right picture to the healthcare providers. That is the way technology is a huge play in the wearable area, right, CJ?
Yeah, absolutely. And I think it will really transform. And I'm not saying anything that no one else has said, right? But it is going to really transform the character of our work. We will be going from being able to, having to take the raw data and interpret it on the fly and make decisions, to being able to have some assistance in understanding the implications of the data coming in and then making decisions from there. So it will elevate, I think, and accelerate our ability to intervene in a timely way. Now, I will confess, I had again, I love talking to people in healthcare. It's fantastic. So I was out talking to a customer today, and one of the things, they're operationalizing AI. They have a fantastic, AI governance model where they evaluate the models coming in for both like the clinical setting and of course the back office setting. But one thing that they brought up is, the ability to measure the actual like ROI and effectiveness of these models. And like, I like this org is so fantastic. They're I think a little bit ahead of the curve in terms of like having a structure in place to be able to do this. But they had a clinical AI model, and it was, their clinicians were like, it is hallucinating. It's not doing what we need it to do. It is not helping. It's making my life harder, and so they got rid of it. And I think we're going to see a lot of cycles of that as we continue to refine, refine what we build, but also how we build it and who is at the table when we build it as well.
CJ, I will hand over a little bit after that to Rajita, but the American healthcare system is a paradox. More you spend, less care you are getting. What is this? That patients are not happy, doctors are not happy, nurses are not happy, no one is happy in the system. What is wrong with that? How do you think? Where is you are the first, the witness for all these things. You are the front line. You're on the front line for that. Yeah. What do you think we need to fix in this area? What are the things is challenging here?
Well, I mean, quite frankly, it's why I moved from the healthcare delivery space to the technology space, because I think technology has a huge role to play in unifying those systems. Right now, all of those systems are siloed in a lot of different ways, not just in terms of technology, but also in terms of process and goals and all of that. Like, it's a very fractured ecosystem. But the more that we can, one, create a unified platform, but two, be able to leverage the data to tell the real story. And like Rajita, this is where I'm interested in your thoughts, particularly as like a healthcare coach, but be able to tell like the story from the perspective of the patient, so that we can understand how can we really like start to optimize around that. Because if we are able to help our patients be healthy at an affordable price, that is what is really going to unify, to drive a lot of the innovation on the back end. But I think it starts with a unified platform, and it starts with understanding the right data. So
I let Rajita talk, but I tell you, when you say unified data, you remind me. I did say that before the show, that you remind me Florence Nightingale. A lot of people think Florence Nightingale is just nurse. She's a mathematician, statistician. She was unified data and interoperability. She was a big first one, on the paper, not on the computers, but she was the first one to start the interoperability and the unified data kind of a structure. That is really that is a crux of the nursing people understood at that time, and not before any healthcare system. She was. Rajita, go ahead. Rajita, you can answer this.
Yeah, talking about that, CJ, right now, as you have pointed out, we work in silos, right? Patient comes in, goes home, and then prescriptions are written, the pharmacy fills it. You don't know if they filled it or not. These are the real things that we are seeing. Did they fill it? Did they not fill it? Is it what's the barrier to it? Is it the financials, or something else is going on? Is it the side effects that they're having? They just stopped and not communicating with the physician, and then the patient comes into the ER and we say, okay, this patient has been non-compliant.
Yes.
We don't know what's behind the scenes going on.
Yeah.
Like, how do we tap into this? Now we have come so far ahead with technology, right? How do we get into those areas where we understand what's going on behind the scenes? Here, we don't have that many, like human nurses talking to the patients to understand. If we can also use the assistance of some technology along with that, where we really know, okay, to improve the patient outcomes, to avoid that readmission, again, that financial burden, readmission costs, the outcomes, and the trust the patient, the trust is being broken.
Yes.
Quite a few patients don't trust our system the way it is right now. What are your thoughts about that? How can
Yeah,
we
if I just, are you asking about the patient compliancy, that the focus right there? That's a compliancy of the patients. That, Rajita, if I
No, no, not the compliance. Like, because patients go home, sometimes they're not able to fill things like that. And we don't know what the story behind is, why
Yeah.
they're not able to follow through, why they're not able to comply. So,
yeah, that's
using the technology assistance, what are some of the
Yeah.
things that we possibly can do? Those are some of the real life issues we face every day. Um,
Yeah. And I think that that's one of like just about every clinician I know, like they got into the business because they wanted to take care of people and they wanted to understand and be able to ingest someone's story and then help, right? But I think one of the fundamental problems is just how overburdened their work is. Like nobody has time. Like nobody has time to stop and listen to and understand deeply like what is going on for a lot of our patients, because they're just like focused on like what is the next most important thing that I need to do to make sure everybody stays alive, right? There's not a lot of bandwidth moment to moment to be able to understand the story. And so one place where I think, we have the first place is giving the gift of time back to our clinicians. And that looks a lot like there's a lot of different ways that you do that. It's easy to say that out loud, but it's everything from our documentation practices to how do you leverage technology to be able to surface and condense the patient story. So I don't have to go through, pages and pages and pages and pages of historical notes. Like I can have a summary of all that so I have an idea of what I'm walking into. The patient needs to have access to their own data, like, and to be able to understand, have resources also associated with, have visibility into how their lifestyle is impacting their care, but also like visibility into what resources are available to them to help. Like so often it's hard to even understand like who can I go to for help with this thing, what programs can I be enrolled with to help me with whatever challenge I'm experiencing. And then and then of and then of course, like rounding that out, like you give the gift of time, you give the gift of insight, and then you can give the gift of relationship where I can sit and look at someone's face and we can have a real conversation about what I can do as a clinician accountable to you for your care to support you. And that accountability piece, I also think is spread across a lot of different people right now. And so when everyone's accountable, nobody is to our patient. And so being able to create that, again, longitudinal view in it, not just when you create a longitudinal view, I think it's much easier to create that longitudinal accountability as well.
how
So
much of the part of the social determinants? You have social determinants, population health, and
mhm.
then maybe family itself. My daughter says that, Dad, I'm more important. It's for me. My daughter's word, giving my word to my daughter is a more compliancy rather than a doctor or anybody else. Dad, you take blood pressure medication. I can't lie to her. I
Mhm.
can lie to the doctor. How much that social determinancy, that the population health and family values, all of them combined, probably that's overwhelming data. Only technology can do that, right?
Yeah, I mean, technology is what is can ingest all of that and then deliver the communication, and like the support structure that our patients need and our clinicians need to be effective. And there's, I think you mentioned earlier, like being able to use ChatGPT to create something that, a 5-year-old will understand, like, embedding some of those tools into the workflow. So it's really, I don't have to go out to ChatGPT to do it. Like I can create patient specific literature and content based on the contextual understanding of who that patient is, what their environment is, what are their barriers to success, and the conversations that I've had with that patient. And like being able to distill that, deliver that to patients in a mechanism that they understand, whether it's their reading level, their language, their comprehension, whatever it may be, like that's another gift that we can give to our clinicians and patients by making some of that distillation much more accessible.
I'm gonna
You
look
guys
at it.
working on that?
Go ahead,
No,
Sajita.
I just curious. Are you guys working on that?
Oh, I probably cannot.
I
I will like we are working on evaluating like how can we move into a workflow that is AI driven rather than like structured on, as Romana said at the beginning of the call, a billing system and a like we basically, like with these legacy EMRs, like replicated a paper process. So as we reimagine what does an AI driven healthcare ecosystem look like, and you'll notice that I'm not talking specifically even about the EMR, because a healthcare system is much more than their EMR. But as you transition there's a ton of ways that you leverage AI to deliver on all of the things that we're talking about today.
One of the things that CJ is, I'm in Silicon Valley. I'm in the San Francisco is not that far from here.
Mm-hmm.
We see a lot of homeless people here. Okay,
Mm.
and with the mental health problems, they are. It is just unbelievable. We are one of the richest, the $3 trillion in this small place, and then you have a number of homeless people and with the mental health problems. Mental health the crisis is going to be bigger than economic crisis now. So how do you think that we can address this? I'm asking you as a nurse, how do you see peace every day within the family, outside of the family, your friends and family? This is a big problem. How do we are, and also technology pressure itself. Even though I'm a technology guy, you see that what happened today, that I forgot just one piece there, and I have to go and run it, get it. So these are the pressures that we have. How do we solve these? You think that becomes manifest into disease eventually, right? So how do we solve these prevention side of it in the mental health situations there?
Mm. Yeah, I think it really starts. That's a huge
You
question.
sound very pessimistic.
Yeah. I think it starts with access, but access to the right services, and that's where, again, like data really becomes essential. Like having insight into your population and what is going to be the most impactful intervention. And I can talk about like, simulation and forecasting and like being able to look at some of your patient population insights and being able to bring, you leverage some of those population-based like simulation forecasting insights so that you can invest in the right way for those, especially really vulnerable populations. So I think that's a component of it. But when you think about, we keep talking about like the power of relationships. Like it's this balance of supporting the folks who are able to go and have those meaningful interactions with our most vulnerable populations, and then building a technological backup so that they can go do the work that they need to do, capture and then capture the information, document the interventions, all of that at the point that they're doing it, rather, so that we can continue to create structures that support those organizations. And then, another component of that access, of course, is related to the cost of care, right? So being able to support healthcare organizations' financial performance through efficiency and optimization, and being able to provide, drive some of the like broad optimizations that can result in significant cost savings that then allow them to invest in structures that support these vulnerable populations, I think is another component there.
That's one of the things that we developed here in Silicon Valley is really effective. Is that the Brain Cafe, which is the virtual reality and neurofeedback
Yeah.
system, They are very effective. Actually, I
Cool.
started Green Cafe, just put together. I started in Atlanta, Georgia. In fact, I helped her to not Rajita, but some other woman entrepreneur just started Brain Cafe. Just put a number of stations, virtual reality stations, and the neurofeedback stations. Really helped. Really, I can see on the EEG the immediately the beta waves almost dropping in seconds to alpha waves. It's an amazing this technology.
Wow.
The fact is, you can see literally that neurofeedback training after that is literally helps in this, because our monkey brains always go with all kinds of all directions.
Yeah.
I saw the first effect of the technology. That's a real side of the story there.
Wow.
Yeah.
Yeah, and I love, like, I do tend to get so caught up in like my operational mode of like, how do we leverage technology to make the life of the clinician better? But I love you bringing up like some of these, really neat and dynamic, cutting edge, like creative ways that we can bring some of these solutions to bear on, just across the whole spectrum of healthcare delivery. I think. I was talking to another friend who's in a pediatric hospital, and they're also using like AR and VR in really interesting ways, and to help decrease anxiety, like during procedures or like before procedures. And like my daughter just had to go get like blood drawn, and they had this whole like, she just put the goggles on, and like it was like a happy ocean scene or something like that, and they drew her blood, no problem. Something she was super anxious about, and then it turned into something fun. So it's really neat.
So Rajita used to tell me that write something. You write every day. Whatever you're feeling in the morning, they write it down, and yeah, really effective. Some extent I need to tell her that. But that's one in the if you don't have the technology access to technology, that's a one way to solve the problem.
Yeah.
Rajita, that nurses go
Simple.
through a lot of stress.
Yes.
Nurses are the first frontline critical care nurses. We interviewed one of them before with you. So tell me a little bit about that. How do you solve that the stress the nurses, particularly critical care? That is I cannot imagine somebody is dying on them every day. Every what do you say to that situation there? Can you hear me? Can you hear me? What happened?
Uh-oh. Did we lose her? Oh no. Rajita, can you hear us? Testing, testing, one, two,
Yeah,
three.
yeah, yeah. Oh,
Yeah,
I thought you were asking CJ.
no, I'm asking you. The question is that nurses go through a lot of stresses in the everyday. The particularly critical care nurses. She was mentioning. CJ is talking about that the webinar. So that is really stressful. I mean, I cannot imagine everybody is dying on them or heart attack and life and death questions. How do you face that? How do you that mental health is? I cannot imagine from outsider. Tell me about that. How do you solve that stress for them? What kind
that
of
that's what that is very challenging, because when you are seeing these patients, either dying on you or not getting better, you're working with them. So that's why kind of lot of the healthcare facilities now, I am at Emory, we have a very robust wellness program. So we have a lot of initiatives with the employees, like stress first aid. We have those resources for them. And then I have recently just completed a research study on breath work, simple breath work that we have it already amongst, with us, the breathing, using that to lower the stress, get into that sympathetic, get out of that, get out of the sympathetic, get into the parasympathetic. How can we calm ourselves? Even simple things like, you can get out, into the nature, look out the window, just that greenery. And earlier, what Ramana was saying, expressive writing, the research was done by Dr. Pennybaker, where you just put in all your thoughts there and you tear it up and disconnect those emotions from that. So there are a lot of different programs that we offer for the employees, where they have also like a Zendan room where they can go in, take little breaks, and also talking to them. We have chaplains going around, talking to them, serving some tea, just having casual conversation. These are the different things quite a few of the healthcare institutions are doing to help their employees with their mental health, for their own health, because when the nurses are healthy, healthy nurse is a healthy nation. When they are healthy, then they're able to take care of their patients and have better patient outcomes. So that's a win-win for both ends. So yeah, that's what is going on right now. Is employee wellness is a big thing in
See,
healthcare institutions.
CJ, I saw in your website you're heading to the conference in Orlando. So, what is all that AI conference? What are the new things that you're talking about? What are the exciting things coming in? Clinical trials? Yes, so tell us a little bit
Behavioral health
about
and yeah. So what that healthcare conference is really all about, where, what is our innovation in healthcare look like right now, and what we have today and where it's going. So some of the things that I'm really excited that we get to participate in, that I get to participate in. So we'll be sharing a lot around, clinical analytics. We'll be sharing a lot around what we are doing to drive that new AI-driven workforce and that AI-driven workflow. A lot of really cool. I'm biased. I get really excited about what we're doing in scheduling. So, Rajitha, as you talk about, being able to have the support system to drive employee wellness. A component of that is also ensuring safe staffing, and that you're aligning staff skills to the patient population. And to do that, you need to have a pretty robust understanding of the workload associated with those patients. Forecasted patient volumes, need to have insight into your staff skills, and then bring all of that together. And then, you also can add in some decision support associated with that. And so we'll be talking about that. It's honestly one of my favorite things right now, just how rapidly we are innovating in that space for solutions for nurses and for nurse leaders, both in terms of analytics and scheduling. And I will share one thing about it, because I just think it is so cool. And all this is publicly available. So one of the things we're working on, one of the things we have with advanced scheduling is, you talk about being able to deliver time back to people so they can look at their patients in the face and not like run around. So, and being able to leverage the right tool for the right use case instead of just painting with a broad brush. So, we've embedded some really cool decision support within that scheduling solution. So like, I, as a charge nurse, can go in and say, like, I am overscheduled for Thursday. And then based on your organization's policies and procedures, your understanding of, risk for burnout, who's in overtime, who's, there with, who signed up for a shift with incentive pay or something like that, who, based on union rules should or should not be called off. Like, you'll get a recommendation, and then you can like automate the notification associated with that. And like that whole interaction, like when I was a nurse, and it, a little bit less when I was a charge nurse, and a little bit less when I was a manager, like I used to get so stressed out about like, who can I call in? Who should I call off? And like, I wasn't making decisions to optimize for like, my buddies' like well-being. I was just focused on who will agree to come in, or who will stay, who will agree to go off. And so being able to build in some of those things that not just support the person making the decision, but also to be able to support, the organization's compliance and financial performance by, optimizing for, cost effective, being able to fill shifts in the most cost effective way, is just really exciting to be a part of that and to talk to the folks who are actually using it. So there's a bunch of different things like that. Like, there's all over the place. Like, there's some really cool innovations we're doing in the real-time health system space right now. So we'll be featuring all of that, like innovation in healthcare at that conference.
That is
I'm
cool.
Yeah.
Wow, that takes so much headache out of, the person who's making the schedule, and it makes their life so much easier.
Oh yeah. And even like in those moment to moment like decisions too. So one is like, you're able to generate a schedule that optimizes for your patient outcomes and your staff outcomes without, sitting and dragging and dropping and, creating a schedule is probably like, it was always the most stressful part for me. I used to spend almost half of my time creating a schedule that folks would actually, and then still at the end, like it never worked out and people always fussed at you. Like there was always something, right? But to be able to deliver that time back to our leaders so that then they can do more strategic things and then have confidence that the schedule that is generated is based on insights that you would never really necessarily, like the human brain cannot really generate, right? And then of course the decision support too, like and like it'll just keep going. So like, I was talking to another organization just about, and I think Romano, we were talking about it before this call, like the ability to tell your story is the most impactful, the most powerful tool that you have. And something that I think in nursing that we've struggled with a long time is the ability to effectively tell our story to folks who have never touched a patient, right? Who have never been on a floor, who have never had like the call bell and the beeper and the doctor and the other nurse and the patient calling out of bed. Like they've never had that like overwhelming experience of I have too much work for one person to do. And if I fail, something horrible is going to happen. And so when you think about being able to leverage all this data to tell your story, is so powerful. And so when you think about even in just like this relatively narrow use case of scheduling, being able to bring together, insights on how are your workflow practices, like, documenting after your shift ends, the amount of overtime somebody's in, the intensity of their work while they're actually doing their shift, with some of your other metrics around like what are my hospital, acquired condition data, with some of your other data around like financial performance and the cost of care, and then being able to bring all that together and then to start to be able to forecast and simulate based on different actions that you can take as an organization. Like that is providing so much power to our nurse leaders to be able to leverage their own data to tell the story about what they need to continue to deliver excellent care. And quite frankly, that's one of my it is the motivating factor, aside from transforming healthcare so that my daughter doesn't become a burned out nurse manager like me, but to empower my peers to be able to tell their story effectively, because I really do believe in a nurse's ability to change the world.
Talking about stories, before I close, I want to tell you a short story. I'm interviewing next month. Yeah, I interviewed him before. He's a roommate of Steve Jobs. He went to India together with him. He traveled India together. He told me a story that's very striking to me. He said that he was traveling in the northern part of India, in the Himalayas and all this. He saw at the 1960s, India, where me and Rajita come from, the India is under a poverty stricken. There was a lot of poor people there. It's a really, really bad things both of them saw. Beggars everywhere. There are people starving. 1960 is a very different world. India is. You know what? He told the Steve Jobs said to his friend, Daniel Katki, his name. He's coming on my show next month. He said that, you know what? I'm going to solve this problem of poverty with the technology. That's what he said. That's exactly what happened to India. India became a superpower, kind of becoming a superpower with the technology. So that is the best story that he told that to his friend. You eloquently said that, CJ. You remodified that story beautiful way. Then I think there is technology as a very important role to play, and then technology is not a central role. You are the central figure, and how you use technology to deliver that care and much more. We need to give the tools for you, both of you. You are like examples of how our healthcare system still that connection there because of you guys. I tell you, you are the heroes of that. And that is thank you so much. Tell me some last words. Thank you, Rajita, and thank you, CJ. Thank you for coming on the show. I'm truly honored and privileged to have you. And
Uh,
wonderful to have you.
Well, I'm honored to be here. So thank you so much for the invite. I think, my takeaway is, I'm going to go back to what you said at the beginning, which is, technology comes last. It's what you're trying to accomplish comes first. And at the end of the day, what we're all here to do is to drive healthier lives and to support our neighbors, or support our fellow man in living as long and as healthfully as we can. And so, our role as the ability, playing a center role in the ability to orchestrate the technology and the data in this moment of tremendous upheaval and change is definitely an exciting time. But I do deeply believe that the unique skills that nursing brings to the table to identify and orchestrate the opportunity that we have at this moment of flexion is unparalleled across the healthcare industry.
Thank you. Beautifully said. Unless we bring a digital twin for CJ. Right. Good morning. Hey, good night, all of you. Thank you for joining us. Stay there on the line. And just thank you so much.
Net bricks on the
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it